Hello, everyone. Today I will be talking about the significant increase of drug and alcohol usage among adolescents. However, before we get started, here's a little bit about me. I'm Saachi Jain, a rising junior at the University of Toronto Schools. My passions include biology, global health, and the liberal arts. I'm a part of many extracurriculars, including HOSA, DECA, and dance. In the future, I not only aspire to work in the medical field, but also continue to raise awareness regarding imperative global issues and be an advocate for change. One of these issues being substance abuse among teens. So, why do teenagers take drugs or consume alcohol in the first place? The four primary reasons, according to the National Institute of Drug Abuse, are euphoria, rebellion, pressure, and escape. Starting off with euphoria. Many teenagers simply enjoy the feeling that comes with taking drugs or drinking alcohol, due to them often releasing dopamine or serotonin. This may be in the form of happiness, power, serenity, or calmness, which can be easily addicting. The second core reason why teenagers use substances is to be rebellious. Using drugs and alcohol can be seen as a way for teens to flaunt their independence and create distance from authoritative figures. Misunderstood teens use drugs as they long to escape to a more idealistic world. Third is outside pressure, whether that be from friends, family, and or social media. Teens can be urged to try substances that they see others enjoying in social settings. These external pressures often underplay the potentially negative side effects of certain substances. The last and most common reason as to why teens consume drugs and alcohol is because they act as an escape from mental health issues. Adolescents who suffer with past trauma, stress, anxiety, depression, or other mental health issues tend to turn to drugs as a coping mechanism due to their instant gratification. Developing areas are uniquely vulnerable to this issue as they turn to drugs to cope with hardships brought by economic and social disparities. Adolescents who misuse drugs and alcohol tend to depend on them in lieu of a support system. However, due to this, teens don't end up building stable and healthy safety nets. Therefore, it is important to guide youth from a young age. Substance usage among teens has been a prevalent issue for many years now. The National Center for Drug Abuse Statistics reported that in the United States alone, around 50% or 1 in 2 of teenagers have abused a drug at least once. Drug usage among 8th graders increased by 61% from 2016 to 2020, despite active anti-drug campaigns. And 62% of teenagers in the 12th grade have abused alcohol. These statistics show how prominent this issue is and really how many adolescents fall into substance abuse at early ages. Now moving on to the primary harmful substances used by youth today and how adolescents access them in the first place. Alcohol is by far the most commonly abused substance among teens and young adults. Many teenagers obtain alcohol primarily from their families or through the use of fake IDs. According to the World Health Organization, worldwide, 5% of all deaths of young people between the ages of 15 and 29 are attributable to alcohol use. Here's a map of the United States showing the percentage of 12 to 17-year-olds who reported using alcohol in the last month. Notice how prevalent alcohol usage is, with on average 1 in 10 students using alcohol every month. In terms of nicotine, e-cigarettes have drastically increased in popularity. Vapes were originally designed to allow long-term smokers to ease into quitting. However, many teenagers have been addicted to vaping. This was particularly because e-cigarettes were marketed towards younger people, with various flavors and vape tricks hooking a whole new generation to nicotine. According to the CDC, around 84% of teenagers who use drugs specifically used marijuana. Marijuana is one of the most commonly used drugs among teens, and it's increasing in popularity. Many times they obtain marijuana from online sales and their peers who sell them. 5% of 12 to 17-year-olds reported using cocaine in the last year, according to the National Institute of Health. Teens mainly combine cocaine with alcohol to allow them to drink more. Stimulants such as Adderall are a class of drugs typically used to treat conditions such as ADHD as they require a prescription. Many times, students use these drugs to boost academic performance. The National Center for Drug Abuse Statistics reported 3.4% of 12th grade students have used prescription drugs within the past year. Teens who abuse prescription painkillers tend to do so in combination with alcohol or other drugs. Many times, teens can obtain these drugs through illegitimate online pharmacies. Here's a map showing the most common substances used in each country, with alcohol, cannabis, and cocaine being the most common. There are many negative short-term and long-term effects to taking drugs and drinking alcohol, especially from a young age. Today, we'll be going over the physical, mental, and economic negative effects of substance abuse. Starting off with the negative physical effects of drugs and alcohol. This includes a weakened immune system, various heart conditions, abdominal pain, brain damage, and lung diseases, just to name a few. Many times, misguided teenagers end up consuming more than their body can handle, resulting in an overdose. 11.2% of overdose deaths in America are aged 15 to 24 years. Here's a graph showing the increase of overdose deaths over just the last 20 years. Notice how just in this time period, all OD deaths have increased by a factor of 4. Drugs and alcohol also cause individuals to experiment and leads to riskier behavior, including drunk driving and physical stunts. Motor vehicle crashes are the leading cause of death among 16 to 25-year-olds, where alcohol and/or drugs are a factor in 55% of these crashes. The prefrontal cortex is the part of the brain that is responsible for risk evaluation and decision-making, and it is not completely developed until the mid to late 20s, making teens especially vulnerable to substance abuse. Moving on to the psychological impacts of substance abuse. The use of drugs and alcohol from such a young age often leads to addiction, which has many side effects. This includes increased anger, anxiety, psychosis, bipolar disorders, and depression. Adolescents are easily susceptible to addiction due to a lack of brain development, and therefore crave various substances. Addiction can hinder many aspects of one's life, such as financial stability, work life, family and friends, as well as legal consequences. As mentioned before, teenagers tend to rely on these substances as a support system and lack a healthy, stable safety net, meaning in times of need, they turn to unsafe coping mechanisms. This can increase the severity of pre-existing mental health issues. It is important for teenagers to create these support systems, whether that is with family, friends, trusted adults, a therapist, or group therapy sessions. Now on to the economic effects of substance abuse. The economic cost of drug abuse in the United States was an estimated $193 billion in 2007, $120 billion of which were in loss in productivity, mainly due to labor participation costs, drug abuse treatments, and premature deaths. $11 billion in healthcare costs for drug-related treatments and medical consequences, and the remaining $62 billion in criminal justice costs, primarily for criminal investigation, prosecution, incarceration, and victim costs. Substance abuse among teens is a deep-rooted and difficult issue to solve. There have been many attempts to reduce drug and alcohol usage among teens, and today we'll be going over a few of these strategies. Many in-school programs aim to educate students about the negative effects of drugs and alcohol. This is imperative to make sure they understand the consequences for their actions and helps to combat misinformation. Instead of simply preventing students from taking drugs and alcohol, these ads actually educate students about looking for signs of overdose and properly researching before taking any substances, emphasizing the power of knowledge. The government has also banned substances due to their increasing popularity among adolescents. For example, the company Juul was banned due to the FDA concluding that their sales were not appropriate for public health. In one's family, it is important to safely store and dispose of substances and monitor teens' prescription drug consumption. Making sure young ones don't get access to drugs and alcohol in the first place is a step towards preventing addiction. Today, we have gone over various substances teens use to cope with mental health issues. Adolescents obtain drugs mainly from their family and peers. This global issue is imperative for current and future generations due to the negative effects of substance abuse, primarily addiction and health issues. It is important to educate youth on the negative effects of alcohol and drugs and help them build healthy safety nets. If you or somebody you know is suffering from addiction or substance usage, here are some resources for help. Here are the sources I used to make this presentation. And thank you so much for taking your time to listen, and feel free to contact me via email as well. Thank you.